Hello, welcome again to another edition of Calm in the Chair, the Dental Fear Solution. Today, we're going to be discussing the advantages of using a dental anesthesiologist for more advanced, maybe what we call riskier dental cases or medically compromised cases. What is a dental anesthesiologist? So, a dental anesthesiologist is a dental specialist that's been trained in the administration of deep sedation and general anesthesia for dental and oral procedures, particularly in complex or high risk patients, including children, phobic adults, special needs individuals, and medically compromised patients. These specialists have been trained in a 3-year program. The programs are all hospital based, very competitive to get into. And there's very few actually dental anesthesiologists around the country and very few in Florida. We're very lucky to have one visiting our office once a month, and actually we'll have a full-time one in our new surgical center. So the advantages are obviously improved patient safety for these more complex cases. We get some real special needs cases that are either combative or unresponsive or have cognitive issues, developmental delay, dementia, transplant patients, large BMI patients, and medically unstable patients. And you'd say, why would you treat these? Oh, because they have dental issues, either pain, infection, and they need to be sedated for these kind of cases. And nowadays, especially after COVID, it's very difficult for these cases to be done in a hospital setting. The hospitals actually are not real receptive to having dental cases in the hospital anymore. It's just not profitable for them. That's the main reason why. So these specialists are a great advantage for situations like we have. So we still see under moderate sedation. I see 95% of the patients that are referred to us, but we want to be able to be the go-to, be the wheelhouse for all dental sedation patients. And we get calls daily. Do you take pediatric dental sedation? And I'm actually trained in pediatric advanced life support, certified. Although I won't see any pediatric dental sedation cases unless it's being done with a dental anesthesiologist, just for safety purposes. You're dealing with younger children, younger bodies. It's all based on how much they weigh and the medications and all that. And for safety cases, it's really important to have a dental anesthesiologist on hand for those cases. We also get a lot of, like I mentioned, medically compromised patients that are very unstable, and that's what's sent to us, by other dental offices, by patients that are just looking for somebody who can treat these. A lot of the caregivers or the families, some of these patients are in facilities, so they have to be transported to our offices, and we want to be able to treat these patients safely and restore. Really, we're trying to restore function and health for these patients. So currently, we have a dental anesthesiologist in our offices 1 day a month where we just do dental anesthesiologist cases. So one after another after another. Obviously, these are pre-booked. But starting in the spring of 2026, we will have our surgical center built, and we'll have a dental anesthesiologist full time on hand. So then we'll be doing it every single day. Which is a great advantage for the Tampa Bay area, a great advantage for a lot of these patients that have nowhere to go, and a great advantage really for us that we can treat all patients, from birth to 100 that have sedation needs. So we're kind of the go-to uh, dental sedation practice. We're the largest dental sedation practice in Florida. 12 locations now. The surgical facility will be our 13th. I think when it's complete, it'll be the largest dental office in Hillsborough County. So we're excited for that. We're excited for the opportunity for our patients to be treated there. So, what are some other advantages of a dental anesthesiologist? Well, obviously, they're doing a deeper anesthesia, so they are intubating the patient, breathing for them through the procedure. So we're not concerned when we're doing the dental work with the anesthesia portion of it. It's not a basic case; it's more advanced case. We get some transplant patients out of Tampa General that need to have the infection cleaned up before they can put on the transplant list, and the same thing really for the bone marrow transplant patients. They can have no infection present. So we will sedate them, clean them all up in 1 or 2 appointments, and then sign off that there's no infection, so they can go in the hospital and get those treatments. And they're gonna be in the hospital, for 30 to 60 days. So we definitely want to make sure that they are stable for that procedure. Dental anesthesiologist also uses advanced medications. So all the medications that I use in our moderate sedation IV are all reversible medications. So I can just give the reversal and block it out. Whereas a dental anesthesiologist, is going to be the ones stunning the patient as far as using propofol, ketamine, some of the more advanced medications that needs to be regulated with an anesthesiologist. Same thing for pediatric patients. Like I mentioned earlier, we get calls daily, and we do treat teenagers, with moderate IV sedation, but we want to treat all pediatric patients. So that is coming in the next 6 months, so that those pediatric dentists can either work in the surgical center that we have or send the patients over, and we'll have the proper specialists there to handle those cases. So rest assured at Montreal Family and Sedation Dentistry, we'll be able to treat all dental sedation cases. We currently do have the dental anesthesiologist now on a 1 day a month basis, but coming soon, we'll be on a daily basis. So for more information, regarding any of the sedation opportunities or any of the sedation cases, whether your family member or yourself needs the care, you can always reach us at happydentistry.com. Thank you for listening. And as always, keep smiling. We'll see you soon. Thank you.